So good morning to all. So today we discuss about the topic pharmacology, means the anti-arrhythmic drugs to prevent or stop the arrhythmia. So first, the anti-arrhythmic drug is the Na channel blockers, means the Na means the sodium channel blocker. Okay, first the Na channel blocker means the Na means the sodium, that is the sodium channel blocker. The sodium channel blocker, what is the mechanism? That the QT prolongation. QT prolongation. The sodium channel blocker that causes the QT prolongation means that is the PUF, QRS, PUF, then the QRS, then the T. Clear? That is the ECG. QT prolongation means that is the PUF, that is the QRS complex, that is the TUF, means the Q to T, that is the prolongation. Prolongation means the QT interval is time is more, that is the QT prolongation. The sodium channel causes QT prolongation, that causes torsade D point is clear, causes torsade D clear. The prolongation means that causes the torsade D point is clear. That is the question in the entrance examination. Then second is the quinidine, that is the anti-arrhythmic drug. Second anti-arrhythmic drug, okay, that is the quinidine. Clear? Quinidine, that administered in oral route, administered in the oral route. Clear? The second anti-arrhythmic drug is the quinidine. Clear? It is the quinidine. The quinidine administered in the oral route. Clear? It's the oral route. Clear? The side effect. The side effect is diarrhea. Clear? The quinidine is the anti-arrhythmic drug, that the side effect is the diarrhea. If the question asked in the entrance examination, the side effect of quinidine is the diarrhea. Then class 1C anti-arrhythmic drug. Class 1C. Class 1C. Clear? Class 1C anti-arrhythmic drug. That is the flecainide. Clear? The class 1C anti-arrhythmic drug is the flecainide. Flecainide is the class 1C category of the anti-arrhythmic drug. Clear? It is used for resistant arrhythmia. Resistant arrhythmia. the flecainide is used in which case? If the persistent arrhythmia that happen in the patient, in this case the class 1C antiarrhythmic drug flecainide is used in the resistant arrhythmia. Then another one is propafenone. Propafenone that used in the long term antiarrhythmic management. Clear? The propafenone is used the long term management of antiarrhythmia. That is the propafenone. The long term use of antiarrhythmic drug. So remember carefully this point I am talking here. So it is much more important in your exam point of view. The pharmacology topic based on pharma and the biochemistry. So listen carefully. Then class 1B antiarrhythmic drug. Then the class 1B. Class 1B antiarrhythmic drug. Clear? That is used only used ventricular arrhythmia. Yeah, the class 1B antiarrhythmic drug that used only ventricular arrhythmia. Here used ventricular arrhythmia. Now, the example is the lidocaine. The lidocaine is the class 1B. Lidocaine is the class 1B antiarrhythmic drug that only used in the case of the ventricular arrhythmia. Clear? Ventricular arrhythmia means the one is VT, second one the VF. Clear? Means the lidocaine is used in the VT, means the ventricular tachycardia. Then the VF, that is the ventricular fibrillation. And third one, it is also used in MI, means the myocardial infarction. Lidocaine also used in MI, means the myocardial infarction, MI. Then class 2 antiarrhythmic drug is the beta blocker. Clear? Class 2 antiarrhythmic drug is the beta blocker. Clear? The class 2 antiarrhythmic drug is the beta blocker. Means it causes the AV node block. Clear? The class 2 antiarrhythmic drug, class 2 is the beta blocker. The beta blocker causes the AV, means atrioventricular node block. Atrioventricular node block. Then class 2 antiarrhythmic drug also the myocardial cell block also causes the myocardial cell block. Cell block. The class 2 antiarrhythmic drug also causes the myocardial cell block. Clear? Myocardial cell. The drug of choice is the catecholamines. Catecholamines. Clear? The drug of choice is the catecholamines. Catecholamines is the drug of choice. The myocardial cell block. Then the class 3 antiarrhythmic drug is the potassium channel blocker. Class 3 antiarrhythmic drug. Class 3 antiarrhythmic drug is the K plus channel blocker. Clear? The class 3 antiarrhythmic drug is the K plus means the potassium K plus channel blocker. Clear? The class 3 antiarrhythmic drug is the potassium channel blocker. Clear? The potassium, if the question asks the potassium channel blocker is which category of antiarrhythmic drug, that is the class 3 antiarrhythmic drug. Then the side effect is the QT prolongation. Clear? The potassium channel blocker side effect is the QT prolongation, QT interval prolongation. Clear? That is the P is the QRS complex and T complex. Clear? Then it is the P, that is the QRS complex, then it is the T. The QT prolongation, that is the QT prolongation. Clear? So QT prolongation, that means if the QT prolongation arises, that means that indicates the torsade D pointis. Clear? That arises the torsade D pointis. Clear? Where the QT prolongation is seen means that clearly indicate that is the torsade D pointis. That is the torsade D pointis. Then, what is the mechanism of action of the amiodarone? Clear? Amiodarone. Amiodarone. MOA. MOA means mechanism of action. What is the mechanism of action of amiodarone? Means it is K plus Na Ca and beta blocker. The amiodarone mechanism of action, it is the K plus means the potassium, Na plus means the sodium, Ca plus means the calcium, and the beta blocker. The amiodarone acts as the potassium, sodium, calcium, and the beta blocker. Then the beta blocker, the amiodarone. Then the side effects of amiodarone. The side effects of amiodarone. Side effects of amiodarone. Clear? The other name of the amiodarone is the codarone. Clear? Remember this. The other name of the amiodarone is the codarone. Clear? Then the side effects of the amiodarone. First, the pulmonary fibrosis. Pulmonary fibrosis. Second one is the corneal micro deposition. Clear? The first one is the pulmonary fibrosis. Second one is the corneal micro deposition. Then blue or gray skin. Clear? The blue or gray skin. Then the myocarditis. Myocarditis. Clear? Myocarditis means the infection and inflammation of the myocardium. Then hepatotoxicity. Hepatotoxicity. Clear? Hepato means the liver. Then hypotension. Clear? Hypotension means the low BP. Then photosensitivity. Then the toxic. Clear? Then the side effect of amiodarone. Clear? The side effect of amiodarone. Amiodarone, the other name of the amiodarone is the codarone. First side effect is the pulmonary fibrosis. Second one is the corneal microdeposition. Third one is the blue gray skin. Fourth one is the myocarditis. Fifth one is the hepatotoxicity. Sixth one is the hypotension with the low BP. Seventh one is the photosensitivity. Eighth one is the toxic effect. Clear? That is the 8 type of side effect in the amiodarone. Then the class 4 antiarrhythmic. Class 4. Clear? That is the class 4 antiarrhythmic drug. That is the calcium channel blocker. Clear? That is the calcium channel blocker. The class 4 antiarrhythmic drug is the calcium channel blocker. Clear? The class 4 antiarrhythmic drug is the calcium channel blocker. Means the calcium channel blocker. The calcium channel blocker is the diltiazem. Diltiazem. The class 4 antiarrhythmic drug is the diltiazem that acts as the calcium channel blocker. The side effect SE means the side effect. The side effect, first one is the bradycardia, second one is the hypotension. Clear? The side effect is the bradycardia, second one is the hypotension. Clear? The class 4 antiarrhythmic drug side effect, the bradycardia and the hypotension. Then the adenosine is also a antiarrhythmic drug that also used in the PSVT. Adenosine used in PSVT case. Clear? The adenosine is the antiarrhythmic drug that also used in the PSVT. Adenosine is used in PSVT. PSVT in PSVT the adenosine used in the IV route that immediately push and raise the hand so that it prevents or block the arrhythmia. Then the digoxin. The digoxin. This is the chronic heart failure. Heart failure. The digoxin is used the chronic heart failure case. The patient who is in the chronic heart failure, in case the digoxin is used, the digoxin is used the chronic heart failure patient. Yeah. So that is all about the categories of anti-arrhythmic drugs. So next class we will discuss regarding the another pharmacological topic. So thank you to all.